everyone. So now we are going to look at sacral plexus and how it is supplying which parts of lower limbs and which part of perineum. So sacral plexus provides motor and sensory nerves for posterior thigh, most of the lower leg and entire foot, and along with the part of some pelvis. Now how nerve plexes are arranged in pelvis perineal area, we will also look at them. So first of all, look at this one. Now, okay, so let's suppose this one aorta comes out, and here in front of aorta there is superior hypogastric plexus, and around it there comes nervous plexus, which is thoracolumbar splanchnic nerves, and then from adjacent to the aorta there is inferior hypogastric plexus, and that plexus is comes down, and when these form nervous complex around the urinary bladder, that is known as vesicular plexus, around prostate, that is known as prostatic plexus, around uterus and vagina, that known as uterine plexus, and also it supplies to the rectum through S2, S3 and S4. So in this way these plexuses are arranged in the perineal body. Now look at the another one. There is lumbosacral trunk, has nerve root of L4 to L5, and in front of aorta superior hypogastric plexus, and around that there is the cluster of plexus, that is lumbar plexus. Now these both forms lumbosacral plexus. Lumbar and sacral nerves come and form lumbosacral plexus, and in pelvic part there is sympathetic and parasympathetic plexus, and a pelvic splanchnic plexus, hypogastric plexus placed here, and a sacral plexus which forms lumbosacral plexus. As I already mentioned that lumbosacral plexus has nerve root of L4 to L5, and sacral plexus is S4 to S1 to S4. Both of these combine from L4 to S4, forming lumbosacral plexus which supply the perineum, thigh, and some parts of. Now here you can see autonomous nervous system has two types, parasympathetic and sympathetic nervous system. Sympathetic nervous system helps in fight and flight system, and parasympathetic is for in if you are resting in the room, if you are doing everything is okay, then your parasympathetic nervous system is activated. Sympathetic nervous system has sympathetic chains, and there are the clusters of ganglion in it. These are paravertebral ganglion and perivertebral ganglion, and in parasympathetic nervous system there are 12 cranial nerves, and a vagus nerve is also 10th cranial nerve, which supplies the abdomen, and there are some of the chest organs, and it has it is 10th cranial nerve, vagus nerve. Now coming to the which nerves are arising from sacral plexus. So these are superior gluteal nerve, which supplies gluteus maximus and medius, inferior gluteal nerve which supplies gluteus maximus, and sciatic nerve which supplies posterior thigh, and posterior femoral cutaneous nerve, and pudendal nerve. As we know, pudendal nerve supplies perineum, external genitalia, and anal region. So these are the nerves coming out of the sacral plexus. And if we look at the sciatic nerve, it originates from sacral plexus with L4, 5, S1, S2, S3, except S4. Means almost all of the nerves combine to form a greater sciatic nerve from lumbosacral plexus, and it is branch of plexus, largest nerve of the body, and also it divides or gives peroneal nerve and tibial nerve as well. So there are some of the branches of sacral plexus. These branches are superior gluteal nerve which supplies medius and minimus, inferior gluteus nerve which supplies maximus, posterior cutaneous nerve to piriformis, obturator internus nerve, quadratus femoris nerve, sciatic nerve which is tibial and common peroneal portion, and the last one is pudendal nerve. These are branches of sacral plexus.